talk about reflexes. It's a specific automatic pattern response elicited by a particular stimulus. So it does not involve conscious control. You probably have been to the doctor and he's taken out that little triangular hammer thing and hit it at your knee, right, to see if you have that reflexive response. It produces a change in muscle tone and its distribution. And the motor output that follows some specific sensory output. And it's performed automatically without conscious volition. So it's important. It would be important for you to know what reflex is. The part of a normal development at birth, a baby's movements are controlled by the lower centers of the brain, which generate involuntary reflex movements and postures. Normally, reflexes help to develop normal muscle tone and muscle power and the movement of increasingly coordinated and refined nature. Lower scale reflexes then diminish and finally disappear after having developed a base for the higher level reflexes, which emerged to allow for higher level skilled movements. So basically it's saying that you're born with these reflexes. As you mature and as they develop, the reflexes develop and mature, that the first ones kind of go away, that the second one will be more prominent. We'll get into it here. The newborn is equipped with reflexes for survival. They have eye blink, they cough, they urinate, they defecate, they hiccup, they sneeze. The one major reflex to know for newborns is the rooting. It's that when you touch their cheek, they kind of turn towards it. And also sucking is another reflexive response that a newborn has, which would be something to remember. It's a stimulation to lips and gums or front of the tongue, suckling, swallowing motions. So, you know, if you've ever taken your finger to a baby's mouth, they always want to suck on it, and it's just a reflexive response that they have to it. So these are very basic reflexes. And then peristalsis. Peristalsis is like, it's an involuntary muscle movement, kind of in a wave. Like an example would be when the baby were feeding, that in the esophagus, the muscles would contract automatically, like reflexively. They don't have control over that in order to swallow. The newborn is equipped with reflexes for protection. We have what we call a flexor withdrawal. It's a stimulation to the sole of the foot to uncontrolled flexion of the stimulated leg. So when you go out there and you are in your pediatric settings, you may be able to do some of these type of things with children. So what it's saying is you touch their sole and they're gonna bend their leg. It's just a reflexive response that they have. An extensor thrust is you put pressure to the ball of the foot, of the flexed leg, and it will go to the uncontrolled of the unstimulated leg will extend. So apply pressure to the ball of foot here, which is flexed. It's going to cause this leg to extend. And then you have a Moro and startle reflex. It's dropping the head backward from a semi-seated position, and extension or flexion and abduction of arms and spreading of the fingers.